Okay, so it's my pleasure to welcome everyone to this webinar, which is a very much sort of how it's going webinar, focusing on our FoodSEqual Health intervention, which was funding that we received to specifically deal with health inequalities. In our case, in terms of taking an approach that hopefully removes some of the dietary inequalities that are linked to health inequalities. So I'm just going to remind you a little bit about what the intervention's about, how it's structured, and then hand over to our fabulous postdoctoral team who have actually been doing the work on the ground. And this is designed very much as a work in progress. You will see some data, but we are mid-intervention, so it's by no means complete final. It's really to give an indication of how things are progressing. And to a certain extent, you know, what we're finding easy, what we're finding more challenging, in the hope that others that want to do something similar can learn from our experiences. So the intervention is something called Fresh Street. Many of you will have heard of it before because it's been run by our colleague Claire Elton, now based at Queen Mary University of London, in various other places around the country. But we're running it slightly differently here in FoodSEqual. So the intervention, I think one of the key things to get across is that this is an area-based intervention. We're looking at people by streets, by areas. Clearly there are individuals living in those areas, and we do have to ask individuals questions at some points, but we're trying to aggregate the data to think about area level impacts. And this is really because for the intervention to be successful and to be adopted into, say, local policy and something that we would hope to see continued by local authorities or through local charitable funding, then you really need to know whether it's having an impact at an area level and not just on individuals. So that's why you'll see some aggregation of data and so on. The intervention Fresh Street is really tackling two things. First of all, accessibility of fruit and vegetables in our areas. Many of the areas aren't within easy reach of a supermarket. The supermarkets may be out of price range of people, even if they are able to geographically access them. They are, in the case of at least one site, at the top or the bottom of a very steep hill, and that can cause some challenges for people that perhaps don't have access to their own transport. So there are various access problems. There is, of course, the affordability issue as well, and we've seen that front and centre in much of the early work that we did to understand the foodscape more broadly in the parent FoodSEqual project. So this intervention, it's providing vouchers to 300 households in areas of high indices of multiple deprivation for around 12 months. Where this version of Fresh Street differs slightly from what has been run before is that we're very focused on the presence of community hubs and the role that they can play. So we're not only looking at markers of diet quality, but because these community hubs enable us to hang things like NHS health checks, Citizens Advice Bureau, helping people navigate the world of benefits and those sorts of things, we can go a little bit broader than that. So we are assessing diet quality, well-being, health markers and so on, food affordability, but also things like social connectivity. What role do these community hubs really play, enabling people to feel part of a community? And when people feel part of a community, are they then able to become more active citizens of that community and feel that they have some agency over their own lives, rather than stuff always being done to them or imposed upon them? Clearly, from a research perspective, we're really interested in evaluating the intervention, not only the hard data outcomes that we get from the participants and the control groups and so on, but actually the process evaluation. You know, what's it been like to implement it? What's the context of the factors that impact on its success or otherwise? And the final point I want to make is that we're running this intervention in 2 locations. One is a suburb of Reading, the other one is a suburb of Plymouth. We chose these locations from the 4 that we work in the parent FoodSEqual project because they were had the relationships with the local community hubs already, so we could build on that. But these interventions, as you'll see, are being locally adapted. And I think that's really important, and perhaps something that illustrates a point that I believe in more widely, which is whatever national policies you might have or national directives you might have, it's really important to make sure that they can be locally adapted for delivery in that area so that they can be adjusted so they work best for people in that region. And that might be the people who are recipients of the fruit and vegetables, but also the people who are working with us in terms of providing the fruit and vegetables, of setting up a business, of the community hub itself. You know, local structures are different, needs are different in across the country, and we have to have a certain agility about how we work to deliver the best outcomes for our communities. So the research questions, the primary research question is really about how do we do it? What's the most effective way to embed Fresh Street community within local food systems in these areas of high deprivation? But there are a bunch of secondary questions to follow on from that. Because of this local adaptation, we're actually using slightly different methods in each place for households to receive and redeem vouchers. We want to test the feasibility of the vendor payment system, clearly important for our stakeholders who are the vendors of the fruit and veg. And what's the evidence that we get from the intervention on social connectivity, on addressing health inequalities, on well-being status, dietary behaviours, and on the availability and affordability of fresh produce. We'd like to look more widely than just the people who are directly impacted by the intervention. We'd like to look into local councils and other stakeholders, really with a view to seeing whether we can get this intervention embedded into a local policy for a longer term. And you'll hear me say this a few times in different contexts, that I feel we slightly tread a blurred line between doing research and making sure that that research has impact and makes a difference in this world and is actually able to do something good. So sometimes we find ourselves adapting our research protocols slightly on the fly based on what we find as the intervention progresses, because we know that that is going to be better for the people in that region. And what we don't want to do is to stop it having the most benefit it can by being so rigorous about, we set the research up in this particular way, we're going to do it no matter what. You know, it's we want to make a difference ultimately. And finally, we'll be looking for the return on investment case for continued funding of this, hopefully by local authorities or other agencies, such as the National Lottery and so on. But we need to collect the evidence that shows that it makes a difference. So to briefly kind of cover the intervention design, confusingly, both areas are called Whitley, although you'll see that they're spelled differently. So we have Whitley and Plymouth, Whitley and Reading. Streets have been identified representing a number of different households, roughly 300 households in each area, all in indices of high indices of multiple deprivation, geographically located fairly equidistantly from their local community hub. In each location, 150 of those households receive vouchers. So this is the equivalent of £10 worth of vouchers each fortnight, £5 a week if you prefer. All 300 households in each area are receiving information about the programme of hub-based activities, all of the things that go on around the intervention, whether that's things like NHS health checks and the sort of the external resources provided, whether it's things like cooking classes, discussions around how to store food, anything that our community researchers in their work with the members of the community discover that will be really useful in supporting them to eat more fruits and vegetables. You'll see here the names of the 2 wholesalers who are just invaluable in supporting us with this project. So in Plymouth, we have Tamar Fresh, who's worked with the Plymouth team now for a number of years, incredibly supportive of the local community, and is just as keen as we are to make sure that everyone has access to fruit and vegetables. The Plymouth intervention is being run through a delivery system, and I'll let our postdocs explain that a bit more. In Reading, we are in partnership with Belchers and Son, and they've become really personally involved. And the Reading intervention has been running a little bit longer. It started in mid-November, so it's a little bit more established than the Plymouth version of it. And we've actually ended up running a fruit and veg stall based at the community hub every Saturday morning. What we try and do, of course, is to get the data that we need from that. So from each of those groups of 150 households, we're seeking to recruit roughly 100 individuals to do what we call a food and wellbeing chat. Those of you with a research background would perhaps naturally call this something like a 24-hour dietary recall, an interview on health and well-being and so on. We try not to use those kinds of language because they can be quite a barrier. So the food and wellbeing chat, what it actually ends up being is more or less a 24-hour dietary recall, some questions from the Edinburgh Warwick Wellbeing Survey, some questions from the NHS Wellbeing Survey, some questions from the Food Standards Agency Food Affordability Survey, a little bit of a pick and mix of all of those, and put together in a format delivered by our community researchers and our research staff working full-time on the project, who are able to work with people who are often quite vulnerable, to really elicit really high quality data, truthful responses about how it really is at various points through the project. Aligned to that, we also are asking people if they would not mind providing hair and urine samples so that we can do some independent biomarker assessment, and they're attending NHS-run health checks. And again, we can get the data from those health checks on an area basis. We're not looking for individuals to give us their identity and so on. So in terms of target audiences, if you like, the middle group there that you see, the intervention group, they get everything. They get the vouchers, so they get access to fruit and veg. They have a means of affording fruit and veg. They have all of the community hub activities. The control group gets everything apart from the vouchers, so they get all the access, all of the support, but they don't get the affordability problem solved for them in quite the same way. And then there's what we call the other group, or the rest of the world. Essentially, anyone is welcome to come and use the fruit and vegetable service, and to drop in at the community hub and to engage with the events as well. We're not excluding anyone, but they're not being specifically targeted. I'm now going to hand over to Monique, who's going to talk about some of the initial questions that we asked of people before we actually started the intervention.
Thank you, Carol. So I'm going to share some baseline finding what we been doing in Reading and in Plymouth. So during the first 2 weeks of the intervention, we went to the households and asked the 2 baseline questions. How many portions of fruit did you eat yesterday, and how many portions of vegetables did you eat yesterday? The doorsteps questions were asked to both the intervention and control group at Reading and in Plymouth. So we asked these questions to 300 households at each location. Next slide, please. So this slide shows the portion per day of fruit and vegetable consumption by each group, that is the intervention group and the control group at each location. Plymouth has 159 households in their intervention group and 144 households in the control group, whereas Reading has 153 in the intervention and 145 in their control group. And the percentage response for the two doorstep questions by the control and intervention group were 59 and 43 at Plymouth and 49 and 39 at Reading. The baseline fruit consumption for the intervention group at Plymouth was 1.26 portions per day, whereas for Reading it was around 1.09 portion per day. And for the control group, the fruit consumption was 0.74 portion, whereas for the Reading it was 1.30 portion per day. Similarly, for the veg consumption, for the intervention group at Plymouth, it was 1.23 portions per day, and for Reading, 1.23 portion for Plymouth, and for Reading, it was 1.37 portion, and for control group, it was 0.78 per portion per day, and for Reading, it was 1.44. So it's kind of a similar portion per day of fruit and veg at each location. Next slide, please. So this is the kind of overall results, what we found, the portion per person per day at both location. And what we found is that it's nearly one portion of fruit and one portion of veg. However, the UK government recommendation on fruit and veg is at least 5 portion per day for adults. And the NHS digital data says adults in UK consume on an average 3.7 portions of fruit and veg per day, which means the participants in our study are consuming less than the recommended. Next slide, please. So as Carol said, we did some biomarker work by collecting the urine and hair samples and a food and well-being chat with the participants at each location. The initial findings from the benchmarker of biomarker and food and well-being chat show some interesting results. When we compared our data with the NDNS data, we found no significant difference in the energy intake between the two groups. And the if you can see the graph here, the energy intake is a bit lower for the FoodSEqual cohort, and that might be due to the difference in age, sex, or BMI distribution. Next slide, please. However, for the fiber intake, we found a significant difference between the NDNS data and the FoodSEqual cohort, which might suggest that maybe less intake of fruit and veg in their diet. However, further analysis is needed to confirm this. So this was the initial findings from what we did in Reading. So I will now hand over to Plymouth team.
Yeah, can you hear us? Okay.
Okay, hello. So first of all, I just described the area in general. The area of Whitley is like a long, narrow piece of land, virtually all social or ex-social housing. As you can see on the map, it's flanked by woodland, sort of like to the north and the south, if that's the way the compass is pointing, and it slopes down. So from the woodland at the top to the woodland at the bottom on the map is actually how the land slopes. We're quite hilly here in Plymouth. The housing is predominantly social or ex-social housing and a mix of good repair and more neglected properties. And what we're looking at in the map is the middle section. And if you can see a road that goes kind of across the middle from left to right, that's the main road going right through the area. It's about 1.5 miles long. We had a choice of 2 venues to base the project. If you look at the green marker, that's Fourgreens, where we are now, and FoodSEqual in general uses that venue quite a lot. And then the that venue is used for our food bank, the community larder, and lots of other things. And if you look at the area with the red triangle, that's the Salvation Army, which is a church with really big rooms, very good facilities. They do a lot of community events up there. And that one was chosen actually from a practical point of view, that they could accommodate what we needed on Tuesdays and Thursdays. One of the advantages to be there is that it distances us a little bit from the food bank and from the larder. People have a preconception that it's about give away food to those who need it, and actually it's a separate project. So it does help us to distinguish between the two. The two streets chosen from the project are, if you look at the ends of the streets, they are a sort of an equal distance from the Salvation Army, the red area. And then the intervention street going uphill to the left, it looks like a shorter street because there are maybe more flats in that area, excuse me, and because there are houses on both sides of the street, whereas if you look at the yellow, the control street, it faces the woodland, and in some of that area, there are only houses on one side of the street. Both streets are long enough to accommodate the numbers that we're looking at. And had we chosen 4 greens, the green pin, as our base, we would have probably started at the other end for the yellow street, which would still have been an equal distance. So that's why we chose those areas. It looks pretty fair on a map. Thank you.
Next slide, please.
Me again. Trying now. Okay. So we have started to operate a fortnightly ordering and collection system of pre-ordered bags. These bags, this stuff is delivered in boxes from Tamar Fresh, who are our local wholesaler, and they are providing us with seasonal vegetables. So from one week to the next, it's as a veg box would be. The vegetables are sorted from the boxes into bags by the team before the participants arrive, and each bag is valued at £5. So people can order one at £5 and then maybe bank their vouchers for another time. They can buy 2 at £10, 4 at £20. So, you know, we're not limiting how much stuff people buy with their vouchers. And obviously, if people want to use cash or a card, obviously there's no limit on that either. Orders are placed on Tuesdays between 10 and 12. And then the Thursday following that Tuesday, they can collect between 10 and 12. And at that time, there are refreshments, chat available, activities. The following week, there's no intervention. And the week after that, we are back to the Tuesday, Thursday pattern. We had a promotional giveaway on the 18th of December at the Salvation Army, where we were giving away bags of seasonal fruit and vegetables, so people had a taste of, literally, of what they would be getting if they took part in the project. And we gave out some flyers and we had refreshments and we chatted about the project and other kind of food related stuff. The actual intervention started on Tuesday, the 16th of January, and we've had 4 weeks of orders, and next week will be our 5th week. Thank you.
Next slide, please.
Right, this is what's in the actual boxes that we have every other week. The first week was very good because we had 2 bananas, oranges, tomatoes, carrots, lettuce, savoury cabbage, baked potatoes and parsnip, and everybody was happy with that. The second week we had no potatoes and no parsnips, and they didn't really like it because obviously they wanted potatoes, but they wanted basically what they had in the first week, so they were left less. There was a bit of a I'm not sure this is worth it. So the third week we had the bananas back, oranges, and we had the carrots, lettuce, the cabbage and the baked potatoes, and they were a lot happier because they had the baked potatoes, and purely that's because I suppose you can do mash with it, chips, anything like that if you've got your potatoes. And the fourth week we had quite a bit and everybody was happy with the fourth week. They were all really happy. I have spoken to a few of them, and they say, you know, that the vegetables that they are getting are fresh. They like them. They last a lot longer, you know, than what you would get from the food bank, because obviously from the food bank it's literally just a few days, whereas the veg they can keep and they can cook meals with. Obviously it's free from, which is helping their bank balance, because there is a lot of people that can't, just physically can't go out and buy the veg.
Yes, so this is a slide just representing the kind of split we've had with the purchase of the bags that were just explained. We've had 4 weeks, as Eve mentioned, and this kind of divides it into the 3 groups that Carol was talking about: the intervention group, control group, and all the others, which is literally anybody else from Whitley or outside Whitley who wants to order a bag. So as predicted, we've had more bags ordered from the intervention street because these people actually have the vouchers to purchase the veg from, or the fruit and veg from. So we've had a good amount of people coming in when compared to the other groups. And with the control group, it's been a little challenging to increase engagement. We've had one person coming in just once. So we are looking at ways to potentially increase engagement with the control group. We're going to be sending out new sets of letters this week to the households, telling them that we're still here, there are activities going on, it's still welcome to everyone. And as far as the third group is concerned, this happens more of on an ad hoc basis. The people who are coming to the Salvation Army anyway for other activities, like for children, for some games and music and stuff, they're hovering around there and they see us standing on our little desk taking orders, and they're just like, okay, we'll try a bag. So that's how we've been getting the orders from the third group, and those are our numbers so far, but hopefully looking for an increase in that. Yeah. Thanks. Next slide, please.
Okay, so as Eve has described, here in Plymouth, we are running a fortnightly cycle of order and delivery, Tuesdays and Thursdays. So people come and pick up their fruit and vegetables on a Thursday from the Salvation Army Hall, and we're based in a big space downstairs. And we're very much aiming to create a very welcoming environment in that space. We have tea, coffee, refreshments, and a range of activities. And we're inviting people to come in, stop for a while, chat, and get engaged in whatever activity we have going that day. The aim of the activities, they're practical, informative, sometimes they're creative, and they're designed to open up the conversations about fruit and vegetables, shopping, eating, cooking, but also to emphasize this is a two-way conversation. We are really listening to what people want to know about. So we'll be planning and programming the events according to what people really want to find out about. We've already heard that people want to know about slow cooking, so we're going to plan a session around slow cooking, get a slow cooker and some recipes from that. What have we done already? We have done a variety of things. We are mapping, we've got a geographical map of the area, which we lay out on a Thursday. We're asking people to come and mark on the map where they shop for their fruit and veg currently, and that will be ongoing. We'll build and capture that. We have some family and children focused activities, so you can see there zine, making little handmade books with collages and found vegetable images. Last week we did a session on vegetable scraps and peelers, and that opened up conversations about kitchen equipment. And so we are also having next a composting session where we will have Joanna, one of our other community researchers, talking about composting and linking into a local composting initiative that participants can get involved in as well. So yeah, we'll be planning and continuing to respond to ideas as the weeks go on.
Slide, please.
During the 4 weeks of intervention, people give us some feedback and comments. So people told us they have trouble carrying the bag to home. Mainly, especially the people, elderly people with a disability, and they also want to choose their own vegetable and fruit. And some people told us they are allergic to some kind of fruit and vegetable that included in our bags. And every Thursday pickup days, we set up the very friendly, welcoming environment. We set up tea and coffee, ask people to sit down and chat with us. But especially during the first 2 weeks, people don't like to stay long. And probably that's because maybe the weather and also our working process, and also maybe this because we just started, people not knowing us very well. And also people report to us that the size and quantity of the bag is inconsistent. That's because we use the local and seasonal vegetable and fruit. And also during the January and February, we have a lot of rain that's will impact the production of the fruit and vegetable. On suitable time from 10 to 12 p.m. That's the day is working time, and most of people are working, so they are not able to come. That explains our maybe slow redemption rate. And also people told us they want to share their other people, not just a friend and neighbor. They even post on their Facebook and ask people if they would like to take the voucher from me. And we also did some observation, and we have some reflection, and we found out the weather is really a big impactor that stop people coming. Suitable timing, yes, we currently excluding working household. We are thinking about some alternatives to the two-visit process which can be cumbersome to some people. We are also planning some promotional market store in spring that with weekly local events. And we have developed some engagement activities, and like Lisa already presented about. And we found that the mapping activity worked very well because it was quick and easy. And the mapping, we ask people where do they usually shop. So it's very easy and quick. And we need to consider how to engage people to collect feedback data and need to streamline the consent taking process. Yeah, last week, actually, it's the week 4, we did, it went very well. And a lot of people, more people like to stay longer with us and talk about their food, their family history with us. It's quite good. That's because we improved our process. Yeah. And also because it's already 4 weeks, people get to know us better. And we have so far, we have 11 people from the intervention street that's dropped out. The main reason is they are not interested in that they don't feel they need the voucher, and they feel people someone else maybe need more. Yes, next slide.
Hello, so I'm Michelle, and I'm just going to go through the intervention design at Whitley. Tricia, if you would like to say anything about the Whitley area, I'd be very welcome. Right. But this is the red streets indicate the intervention area, and the blue streets indicate the control area. And I'll let Tricia talk about the area because she has much more knowledge than I do.
Thank you, Michelle. It was interesting. We at the beginning, we wondered how we were going to choose the streets. We looked on the IMD, and then we also thought about, during COVID, as an organisation, Whitley Community Development Association had delivered lots of parcels. Now, these weren't government food parcels. They were parcels on request of families themselves, their neighbours, their friends, and so on. And a student from the university had done some mapping for us. And interestingly, when we looked at the mapping and at the IMD, they were almost coterminous. So it seemed to be a no-brainer that this was obviously where we wanted, particularly to do the intervention and then keep the control as close by as possible. Whitley is a bit like your Whitley. It's a 1930s between the wars estate, quite a lot of right to buy stuff, but a very mixed, an area with a lot of people in work but not managing very well. You know, this in-work poverty issue is huge, and quite a number of very long-term residents as well who haven't worked in sort of highly paid jobs, quite a lot of retired people and so on. So one of the considerations really was our big issue also about in-work poverty.
Thank you, Tricia. Next slide, please. Okay, so this is the Reading intervention design. So I know we've covered some of this before, but the intervention streets, of which there are 5, they receive a booklet of vouchers every other week for a total of £10. And they also receive the flyer and the letter. And the flyer will advertise the activities that are happening at WCDA, so the Meet Pete and the Citizens Advice Bureau. And then the letter will also provide some information about what's going on. It also provides a public health quote. So 5 portions of fruit a day are good, but 7 are better. And then there's also a recipe on there and some sort of like, did you know quotes as well around. So, you know, did you know parsnips contain vitamin C? That probably is incorrect, so I do apologise for that, but it's around that kind of knowledge sharing items. And then, as was mentioned, the vouchers can be spent at the weekly fruit and vegetable stall, which is held on a Saturday. And this is run by a team of volunteers and staff at WCDA who are there at 7:30 on a Saturday morning, setting up the stall, which laying it out with this beautiful array of vegetables, which people can choose the items that they want. And there's also the option to buy produce in £1 bags. And the stall accepts vouchers, cash and card payments. And on the next slide, if we go to the next slide, we will see how well the stall is doing. It's increasing. So we have our data here from before Christmas. So the 2 gaps in the middle is before Christmas and then after Christmas from the 6th of the 1st onwards. And what we can see that footfall is increasing generally. And of that footfall, the intervention households are the predominant people using the stall, but we've also got this 3rd group which is coming in and slowly increasing as well. So this is really good news. If we go to the next slide, please, we'll look at the voucher spending. And again, this is before Christmas and after Christmas. The red lines, the red bars indicate the vouchers redeemed. So the vouchers that are sent out are £1,500 every 2 weeks. So on average, that's about £750 available each week to be spent. The green line at 450 represents 60% of those vouchers redeemed, so £450. And as we can see, before Christmas, the vouchers redeemed were quite low in comparison to the card and cash transactions. But there's a shift after Christmas where the vouchers redeemed make up the predominant spend. And also we can see that they are increasing. What you may notice, it's not very clear here, but we're noticing sort of like dips. So vouchers issued, peak in spend. The following week, a little bit lower, peak in spend again when the vouchers are issued again. So this is quite interesting as well. Next slide, please. Okay, and this just shows the percentage of the values of the vouchers redeemed over time. What we can see is that it's increasing from sort of 10% at the beginning of the intervention to just under the 40% mark where we are, well, at the 24th of February. So it's slowly increasing and we'll hopefully we'll reach that sort of 60% mark towards the end of the intervention. Next slide, please. Okay, I'll hand over to Tricia for the observations. Thank you.
Thank you, Michelle. It's really interesting. We're doing activities and sometimes they work really well, other times they don't. What's been really interesting for us, we've been running a community hub for a long time. And because the vouchers have literally gone to streets, it's a different group of people that are tending to come over the threshold of the hub. Some of them we haven't yet got inside the building. Our cafe's open on a Saturday too. But the ethnic diversity now is much bigger than it used to be in this very traditional white working class area. For for me, Carol mentioned at the beginning about the sense of community, the neighbourliness. And when you see people actually, one lady went to pay for her veg and she needed to add £1 or something, and a lady next to her also with vouchers said, oh, don't worry, you can have one of mine's, I don't need it. And that kind of thing is just so heartwarming. People are starting to share, they're starting to discuss how they can help each other out, they're starting to talk about what they cook with it. We've now got evidence that a lady's buying from us or using her vouchers from us and then demonstrating her cooking on YouTube. Families are coming in and children are being allowed to touch, taste, smell fruit. So the children are having the choice. And one of the biggest observations for me is people are going for the exotics. People are going for the things they probably wouldn't be able to afford. So what's happening is people are saying, oh, we could never afford a melon or a pineapple or a mango or whatever. Or we've never tried them before because we can't afford them. But with a voucher, we're not going to lose money if they don't like it. We could still buy something else. So all of these things are becoming really evident as we move along, and people are starting to talk a lot more about it, and that real mix. So it's not, oh, you only turn up if you've got a voucher. Anybody in this community can come and they help each other. I think it's Barbara now. Barbara, do you want to do this bit? Have we lost Barbara? Yeah, that's what I'm thinking. Have we lost Barbara?
Shall I carry on? Because
yeah.
Okay. I'm sorry, Barbara, if you're shouting at the screen, I think you might.
Oh, I see her there. She's muted. Unmute, Barbara. She's there.
I'll carry on so that we keep our audience with us. If she manages to unmute, then just start talking, Barbara, and I'll let you take over. As part of the work, we are trying to get a sense beyond the numbers of what people are buying and how they're buying it, of what the impact of the intervention is. And this is just a sort of an illustration of the sorts of comments that we're being told. So the commitment to come on a weekly basis, the fact that it's on the doorstep, we know that this has made a huge difference to some people who have real issues in terms of mobility, both in terms of their personal mobility and ability to access buses, cars, and so on. And for some, this is the first time in years that they've actually had fresh fruit and vegetables in their diet, because they don't normally get that sort of thing, or they have to have it through a delivery service. People are showing us their aspirations. We've known from our work in FoodSEqual that people want to eat a healthier diet. They know what a healthier diet is. They want to incorporate fruit and vegetables, but there are so many barriers to that for them in their lives. And it's great when you sort of see some of these comments and the fact that people are now being given an opportunity to do what they want to do. They talk about the struggle they have to get fruit and veg into their diet, whether that's a struggle through time, skills, juggling the needs of the family, juggling the desires of the family. That sense of encouragement, that one at the bottom right, I'm encouraged to eat this because it's at WCDA. And I think that comes from the sense of community. What we found over the 2.5 years that we've been running FoodSEqual is that conversations about food at that community hub have become normalised. And so we can have a conversation about food without people feeling they're being judged. And that's been incredibly important to move this forwards. Links into the relationship between diet and mental health as well as physical health. She's the person at the top, quite open about the fact that they're struggling with their mental health. But the impact of that goes beyond just health, is that they struggle with things in their daily lives like cooking. And the resort is to then eat salad. which is fine up to a point, but clearly isn't always going to be the route to a healthy, balanced diet, and including fibre and all the other sorts of things that that one might want to do. And I think crucially, feeling that eating food is a pleasure, which is what we really always want from people. So we keep collecting these observations and these quotations and things, and they really inform not only the progress of the intervention, but perhaps what else we need to do to support people. I'm assuming we still don't have Barbara. So the short pause, I will carry on. Trisha's been through some of these observations, people allowing children to choose their own fruit and vegetables. We've had some really interesting occurrences of people who initially were quite negative about vouchers for a variety of reasons. I think, again, the instinctive reaction of some parts of the community was, here's another thing that's being done to us. Here's another thing where we're being picked out and pointed at as being a charity case. Some of those people are now starting to use those vouchers, which is really positive. And what we see is, by doing it on a street basis, is that people talk to their neighbours, because their neighbours are in the same position, given the same opportunities of vouchers and so on. And then there's this sort of groundswell of encouragement that people come along to use the facility. And of course, there's another explanation for that, is that the cost of living crisis is biting ever deeper, and people are now feeling that for a variety of reasons they really would like to use their vouchers. Tricia has talked about the fact that the demographic of people visiting the CDA has diversified since we started this intervention. And what's nice about working with our wholesaler partners, actually in both locations, is if someone requests something, they can get it. So we've had requests for ginger, for mooli, and for things like this. Okra is very popular, so that people feel that they can get the food that they want, and this element of choice, which is fantastic. And it's, I think, really highlights the fact that food is something that reminds people of their heritage and their culture, and it can be incredibly important at bringing people together, but also making people feel part of a community. The social services, so Meet Pete is the NHS health checks, Citizens Advice come, Communicare come, they're busy. We don't really know whether people come from those services and then happen to buy fruit and veg, or whether they come for the fruit and veg, which is planned, and then they access the services when they're there. We know it's kind of working, but we're not quite sure about the drivers, and I guess both may be true to some extent. So we keep unpicking that one. I would like to finish by thanking the research team. You've heard from many of them today, and it's been really nice to have different voices on the call. I'm really sorry we didn't ever manage to get Barbara unmuted and able to make the contribution herself, but she is certainly making a contribution on the ground as one of our community researchers. You heard directly from many of the community researchers and our postdoctoral staff in Plymouth. In Reading, we have Michelle and Monique currently working on the project from the postdoctoral side, but very much supported by Barbara and Emily as the community researchers. I can't thank people enough. It has taken so much energy to get these interventions off the ground, and a real recognition that people have so many different skill sets that they bring to this party. For various reasons to do with the way that this is funded, we initially thought that we had to try and run this fruit and veg stall, particularly at the Reading one, kind of from the university end. And we're not trained to do that. But the Whitley CDA, they run a cafe. They know how to order stock and how to manage supplies and stuff like that. And as soon as we could hand it over to them and say, you know what, you use your expertise, it made life an awful lot easier. And we really see this, and I think something to highlight when you're running these interventions that are based out there in the real world, that fit in with people's lives, is that everyone has something to contribute. Everyone has a lived experience that adds value, if only they'll share it. And so to all of the people who are participating in the intervention, whatever group they're in, my absolute deepest thanks. It's a real challenge because it's a piece of research. We really hope that we can move it beyond that and embed it into normal life for these two communities. but beyond that then into other communities as well. So I thank you very much. I'm going to stop sharing the slides now. And
can I just ask, can you hear me?
I can, whoever that is.
I'm just going to join in here then. Sorry about that. Because I was unmuted, I couldn't unmute. Somebody muted me originally. So what I want to add to that is, for example, on the Saturday when we go into to the fresh fruit, I was able to interview this the week just gone, the weekend just gone, and I'm just going to share one of the interviews I had with a gentleman who's autistic. So he's autistic and he comes to the fruit and veg store, and he says because it gives him routine and the social aspect of meeting people. And he says, you know, people are recognizing him and he's also recognizing people and they're saying hello to him. And sometimes they have a chat. And he found out by visiting the fruit and veg store that Meet Pete are there. And by going to Meet Pete, this led to a health check. And what came out of the health check was that he found that he had high blood pressure. So from having high blood pressure, he's now focused on going to his GP. But he also goes on to say that he feels part of the community when he comes to the fruit and veg store or to the cafe. He likes that the staff welcome him, and he knows that they're going to ask him to count his produce. So he knows that we're going to be there. And because of the routine and friendliness of the staff, now these are his words, yeah, he feels comfortable to be asked questions and to take part in the biomarker data collection. So, you know, I do talk to them about it, what's happening. So it just breaks down barriers and makes it easier for them to come on board when we do eventually come and sign them up. And the fruit and veg said is making him feel healthier because it allows him to get out of the house. Instead of watching 5 episodes of Motorway Patrol, he will now watch only 2 episodes. And it says it just helps him so that he's not isolated, you know. So I mean there's a couple more like that, but I'll just leave it at that one. So I hope that was really helpful and answered some of those questions.
Thank you, Barbara. No, I think that's a wonderful point at which to begin to close off this webinar, because it's those human stories that make such a difference and that motivate this whole team that you see on the screen in front of you. And when you hear stories like that, it shows the depth of difference that we make to individuals. Yeah. And that would be an individual that probably falls under the just about managing bracket, who isn't critically in need of acute healthcare services, but is, you know, perhaps struggling a bit. And
yeah, yes,
these types of interventions that are really hard to measure when they're not there. You know, what are we preventing? We're preventing people really falling into a trap where they need acute healthcare services, or where they feel so isolated that they take a different route, which is again something that we've seen that these community hubs can prevent. So the stories like this, I think, are so powerful to illustrate the value of what we're trying to do, not just in this intervention, but in other things that go on around the country. And often they're criticised because they reach relatively few people versus the numbers that would be in a wider community or in that social economic group across, say, the whole of the UK. But these are research projects. What we want now is to be able to take the evidence from these research projects that it does make a huge difference and find a route to get this into national policy and action. So thank you very much for your support. I've seen there's a load of stuff in the chat down the side. Most of it, I think, has been answered by my lovely team as it's been going on. I'm happy to hang around for a couple of minutes, but otherwise I will formally close off the webinar. We will circulate the recording. And again, thank you very much for your engagement, and thank you for my lovely team.